As the Minister of Health, we realize that one of the biggest challenges in a private health sector service provision has been the issue of financing. If they have to increase the coverage of their services, if they have to increase access of their services, there is need to finance some of the services, some of which are at tertiary level, others are specialized healthcare services. And this requires a lot of funding, substantial amount of funding. And the Ministry of Health, in collaboration with the Ministry of Finance, Planning and Economic Development, is having a conversation on creating a medical credit fund where the private sector health providers can access health financing at a low cost, which can enable them to scale up their service delivery. So that's the point at which we are, not only Ministry of Finance, Planning and Economic Development, but also we are in a collaboration with other health development partners to see that this fund is created and the private health providers can be able to access grants and the loans at low cost to scale up as service delivery. Okay. I had mentioned earlier the private sector plays a very big role. Increasingly, they are playing a very big role on issues to do with the health service delivery. But specifically on reproductive, maternal, newborn, child and adolescent health, they play a major role in terms of provision of services, especially in hard-to-reach areas and in rural settings. Largely, it is the private players who supplement government service delivery in the rural areas and also in hard-to-reach areas, but also in major urban areas, because you find issues to do with the, either health facilities, with the financing, the issue of availability of human resource is a key issue in the private sector. And we believe if we partner with them, if we collaborate with the private health providers, we should be able to see an increase or better indicators, especially related to reproductive, maternal, newborn, child and adolescent health in this country. Largely, it's not less than 2 million US dollars, or maybe can I say around 10 billion Uganda shillings annually to be available and to be accessed by the private health providers. And this will have kind of a revolving component where the monies can be plowed back into the fund, and so that we have increase in the amount of the fund available. As I had said, we are still having a discussion with the Minister of Finance, Planning and Economic Development. And you know, the government, the ministry, the health sector medium-term expenditure framework needs to be adjusted to include that fund into the MTEF, so that the private sector players can begin to access. But there are certain technical discussions which are still happening between the Ministry of Finance, Planning and Economic Development, the private sector players, especially the Uganda Health Federation, and also Ministry of Health. The private sector health providers are a big partner in ensuring that the RMN CAH indicators are improved, because the private sector plays a very big role in terms of access, in terms of coverage, in terms of availability of staff, in terms of facility-based healthcare delivery. They play a very big role. So without any strong dialogue and collaboration and partnership with the private sector, we cannot, to a larger extent, move faster towards universal health coverage and even beat the deadline for the Sustainable Development Goals 2030. If we are to achieve them, we need to support the private health providers, we need to build their capacity, we need to provide financing, and we need to organize the private health providers so that whatever services they are offering has a bigger impact on the indicators. Thank you.